Denmark reporting that refugees have brought in a highly contagious and sometimes fatal bacterial infection. It's called diphtheria into its country. Dr. Marc Siegel is here with us now. Dr. Siegel, explain what this infection does to the body and what are some of the symptoms?
First of all, Joe, I have to tell you, I've always been one of the people, and I've taken a lot of flack for this, for saying let's not be politically correct when it comes to refugees and diseases, because they may not be screened the way everyone else is screened. And we're not screening for diphtheria right now. That's a very, very dangerous disease. It leads to a membrane on the tonsils. It can get you very, very sick. You can have fevers. And you know the worst thing about it, it gives you respiratory symptoms. It's highly contagious. And a lot of us had the vaccine for this, but it wears off within 10 years. So you start to see this. It could easily reemerge in Denmark. It could be a huge problem. And I would encourage everybody, well, I would encourage everybody out there anyway to get the booster vaccine. It's coupled with the tetanus vaccine, tetanus, diphtheria, and pertussis. Everyone should have that at least every 10 years.
How does it spread, and then can you see a scenario in which, for refugees being accepted into a country, getting treated for it and having the vaccination in a timely fashion?
No, it's a great point you're making. It spreads by coughing, by sneezing, sometimes by touch. It's really, really easy to get if you haven't been immunized to it, but it wears off. So I could easily see it spreading into a cluster around the country of Denmark, and then travelers coming to Denmark have to worry about it.
And how do you think a system would be put into place, a public health system, to actually prevent that from happening and still allowing for refugees to come in? Is that possible?
No, it's not possible. I mean, you can treat it, by the way, with an antibiotic, but that's chasing after the horses are out of the barn.
So you cannot be vaccinated for it?
You can be. So maybe everybody around this cluster is going to have to be vaccinated for it right now. You know,
is that expensive? What's the prohibitive factor?
If I were practicing medicine in Denmark, I'd say to every one of my patients, let me give you a booster shot. So this is a huge health care cost. And I think
but specific to the refugees, I didn't really get an answer on that. What do you do for refugees who have been accepted, who need this vaccination? What would you advise?
You'd have to give them the vaccination, but who is going to pay for that? So in addition to having the kindness of taking refugees in, you're going to have to give them this vaccine.
And how much would that cost?
That costs over $100 for one of these vaccines.
For each person?
That's right.
All right. Breaking it down for us, Dr. Marc Siegel.
Very expensive. And I'm not against that. I'm not against saying if a refugee is coming into my country, let's make sure they're vaccinated. We used to do that with tuberculosis. That wasn't a very good vaccine. This is a very good vaccine.
All right. Good to know. So we know the cost. We know what's happening. Thank you so much for giving us the details, Dr. Marc Siegel.